Juvenile nasal angiofibroma is a benign, non-encapsulated, slow-growing, locally aggressive vascular tumor occurring almost exclusively in male adolescent, and it's present with nasopharyngeal mass, nasal obstruction, and recurrent epistaxis. This is axial CT scan showing GNA widening the pterygopalatine fossa and displacing the posterior wall of maxillary sinus. This sign is called Holman-Miller sign, that is classical sign in the angiofibroma. And this is axial CECT showing hyperintensity or enhancing area on the this angiofibroma, and this is widening of pterygopalatine fossa, and you can see extension of this tumor into infratemporal fossa and nasal cavity. This is axial T2 weighted fat saturated magnetic resonance imaging showing dark serpiginous vascular void area within the tumor. You can see in long arrow, and there is invading the sphenoid sinus and clivus posteriorly. This T2 weighted MRI also differentiate this tumor from the mucosal thickening and secretion, and you can compare the opposite side. You can see the opposite normal appearance pterygopalatine fossa. This is axial contrast enhanced T1 weighted MRI showing avid enhancement of tumor extending into the nasopharynx and infratemporal fossa, and you can see the contralateral pterygopalatine fossa is normal, and also you can note posterior wall of the left maxillary sinus is displaced anteriorly, and this is the Holman-Miller sign in MRI. This is DSA in lateral projection showing early vascular blush of the GNA, and this GNA mainly supplied by branches of internal maxillary artery. GNA demonstrate characteristically submucosal spread and early invasion of bone at the pterygoid root or pterygoid wedge and greater wing of sphenoid bone. Bone invasion manifests as avid enhancing soft tissue mass on CT or post-contrast T1 weighted imaging of the MRI. Intracranial extension is more likely finger-like projection through the foramina rather than frank bone restriction is there, and treatment is surgical excision. You can endoscopically or external depending on the size of the tumor.